You know, I started getting into implants in 1986. I was a junior in dental school, and I really thought, wow, this is going to be the step for the future. This is what people are going to get in the future. At that time, it was very experimental. I remember asking a professor at dental school what he thought about implants. He said, don't ever do it, it's malpractice. I just kind of laughed and thought, no, this is what people want, this is what people need. People don't want to wear partials, they don't want to wear dentures. They want to have their own teeth. And implants is like having your third set of teeth. There's nothing more satisfying than doing a set of teeth for somebody who's had a denture or a partial, have them stand up. Many of them just give me a hug. Many of them just look in the mirror and they start crying. They haven't had teeth for years and years, and now they've got a full set of teeth that they don't have to take out, put in a glass. They don't have to worry about putting somewhere else and cleaning. It's their teeth, it's part of them. So part of the body that's lost now is found. And there's nothing more satisfying for me as a dentist than to be a part of that.
It's been great for me for 13 years, and I would strongly advise anybody to get them. A friend of mine who also has them said, you know, it's a quality of life issue, really. It's about improving your life situation, and it's just been a wonderful decision that I have had for these 13 years.
I'm really happy with them. I never thought it would be this good. I mean, I never wanted to have false teeth. Nobody wants to have false teeth, where you have to take them out, so forth. And once they were in, and you know, after a few days or a week or so, once you get used to them, it's just like your own teeth, your original teeth, only better because they don't decay.
Well, you're correct in saying once a person loses their teeth, the jaws begin to shrink. They begin to lose their jawbone. And so some people get what we call witch's chin because they have no bone in between, so when they close, their chin extends out and everything sinks in and it looks sort of like you see a picture of a witch. So that's the term witch's chin. Aesthetically, it makes a patient look 10, 15 years older. And it just takes away that vitality of youth that you have because of your bone structure. So when we restore that with an all-on-4, unlike what you can do with a denture, we can actually replace that area that's been lost so they look 10, 15 years younger. They look great. And the implants we place in stabilize the bone loss so there's no more bone loss. So that process stops. So we have patients that really comment on how more youthful they look. We even have a lot of them that say, you know, my children or some of my neighbors didn't know I had implants, but they keep telling me something's different about you. You just look more youthful. You just look better. And of course, a lot of them are smiling now because they didn't smile before, but they just feel better about themselves. They feel like they've got a new start on life.
You know, I went to my eye doctor, I guess about a year ago, and the lady will sit there and does the pre-exam and the paperwork, and she looked up and she said, "You have the prettiest teeth." And I said, "Well, thank you." I said, "You can buy them."
Well, a lot of times when you have surgery in the mouth, you're removing something, removing teeth that's traumatic. Here, we're actually placing something back in that was lost. And because we're not putting a denture back in, we're giving your teeth right at the same appointment. When they chew and eat, because everybody has to chew and eat, even though they've had surgery, that tissue's not being squeezed, it's not being pressed upon because the teeth are protecting that area. So our patients rarely take any pain meds. We want them to take it the first night, just to make sure they sleep well. But after that, rarely have I had a patient tell me they needed pain meds the next day. And they probably didn't even need them that evening, but we want them to take them just to help them sleep better. So it's a great procedure because most people are scared when they come in. They're afraid. I've had a lot of patients come to me and said, you know, the reason my teeth are this way because I'm scared to death to go to the dentist. And we can put them asleep. There's no trauma. They leave with a full set of teeth that will not cause them pain because there's no nerves attached to it. So their dental problems, pain-wise, are gone.
Well, I tell people I never had any pain. And people tell me that I'm lying, that you have to have pain. It's how bad you want something. And I had very ugly teeth. So I feel to be able to eat food and your mouth not hurt, it's the best thing in the world.
You know, by the way, you have a beautiful smile. Do people tell you, wow, you've got the best
they
smile?
always talk that, and they don't even believe that they're implants. I mean, to this day, they'll say, there's no way. And I tell them all the time, you know, they'll say, you didn't have just a little pain? I said, you know what? If you really want something, you can withstand pain. But I will swear to you, I had no pain. And I didn't. And I had, even through that surgery to put my sinuses up, I don't know how they did it, whether they went up through my back of my mouth or my nose. I mean, I had a lot of work done.
So there's no more root canals, there's no more teeth filling, there's no more crowns. So, you know, you've got that as part of it you got to consider. And then it's just worth it. It's just a good investment. It's a good feeling to have teeth that you can enjoy and not have to worry with dentures and things like that.
This all-on-4, it was really easy. You went in and they pulled all the teeth. I was under sedation, whatever. And all the teeth, put the anchors in, pegs, whatever, and then put the plate in, the teeth, the temporary. And then I walked out.